Hi everyone, my name is Dr. Michael Wald, otherwise known as the Blood Detective. I'm a doctor of chiropractic, a board-certified nutritionist, dietitian, and sports nutritionist. I also provide acupuncture and I'm a life coach, and I have a medical diploma, but not a license to practice medicine. So this conversation is popularized right now in the media. The title of what I've seen in the news feeds is "The Supplements That Actually Fight Inflammation." So I took a look at the article. It was a bit superficial, so I decided to expand upon this, and hopefully you will find this information practical and useful. So what I'm about to tell you is for your educational purposes only. It's not meant as a substitute for sound medical or health advice. And why don't I just start, though, with bringing you up to speed, if you're not already, about why inflammation is bad to begin with. Well, we know that practically, if not all, human diseases have an underlying inflammatory state. Many times it's chronic and low grade, other times it's very high levels of inflammation, but what we see in chronic diseases is low levels over long periods of time causing destructive changes in our body's physiology, metabolic pathways, and destruction of tissues leading to disease. So some of the diseases that we know inflammation is related to are on this particular slide. I've only named 10 of them. I literally could have 1,000 of them here, if not more. So cardiovascular disease, we know, involves inflammation. Cancer progression, neurodegenerative diseases, autoimmune disorders, increased infection severity, which means that if a person has inflammation and they get an infection, that infection could be a lot worse and more difficult to manage. Increased susceptibility to diabetes and metabolic syndrome. A metabolic syndrome is a triad of conditions that involve high blood sugar, high blood pressure, and high blood fats, well established as inflammation underpinning that condition. Chronic lung disease, kidney disease, gastrointestinal disorders, and just fragility of aging itself. So if you're listening to this, it's very likely that you have levels of chronic inflammation. I thought I would just take a couple of minutes here to outline different types of practitioners and who has the best nutrition training, so that if you're considering taking nutritional supplements and you want to get professional guidance, you'll know what practitioner is the best one for that. So for example, we know that medical doctors have less than 25 hours of medical education that spans their entire medical education. And it's very basic nutrition. It's a throwback to the 1950s with very rare conditions today like scurvy, beriberi, and pellagra. So physicians take a few classes. So it's no wonder that when they're asked about the use of nutritional supplements, they say, they're probably not worth looking at, or they're a snake oil, for example. But it's really a very ignorant statement. A doctor of chiropractic has a minimum of 100 to 200 hours of nutrition, so substantially more than your medical doctor or your osteopathic doctor, which are DOs, doctors of osteopathy. And then there's registered dietitians, so they have between 600 and 1,200 hours. And of course, individual practitioners could get extensive additional education. So for example, in chiropractic, there is the DACBN, which is a board certification, which is roughly 300 hours. I have that certification. And there is the CCN, or Certified Clinical Nutritionist certification. That's about 1,000 hours of training. I gave that one up because I did not feel that the education, quite honestly, was up to par, but I did have that for many years. And then there's the DCBCN, which is another board certification in chiropractic, and that's another 300 to 400 hours, and I do have that certification. And then there's the IFM certification, or the Functional Medicine certification, which is about 300 hours, which I also have. And I took that course with the founder of Functional Medicine, Dr. Jeffrey Bland, years ago. So the point here is that if you're looking to use nutritional supplements, or you have serious health issues that you feel nutrition could make a difference, you want to see the appropriate practitioner. Here I've just provided you some scientific references simply because when I do talks like this, some medical doctors get upset that I say they have, almost no hours of nutrition, and when they finally do take my advice and look at their transcripts, they realize that they should not be giving nutritional advice, and certainly not acting adversely towards their clients who ask about it. So these are just some of the medical references. So here are some key anti-inflammatory nutrients that have the potential of reducing different types of inflammation. And there is and are different types of inflammation in the body. We don't have time to go over those here. Today is just a conversation about inflammation in general. But depending on your particular health problem and your type of inflammation or inflammations, these supplements may be of use to you. Maybe some of them won't be. So when I do an intake with a client, I determine that, and we don't want to put the person on the lowest amount of nutritional supplements possible that target their inflammation as best as we can get it. So turmeric, almost everyone today knows, is a strong anti-inflammatory agent, particularly between the 500 and 200 milligram range. But if you're a heavier person, if you have more than one, let's say, serious condition, you might need even more than that. But this is the low-end basic guidelines. And if you combine turmeric with black pepper extract, it is far better absorbed than without that. If you're on blood thinning medications like aspirin and Coumadin, you should not take turmeric unless you are being monitored carefully by a physician. And what's interesting is that, as I mentioned earlier, for years medical doctors poo-pooed nutrition. But now, if you've ever had any medical procedure that involves, let's say, general anesthetic, they will tell you to stop taking either all of your supplements or things like turmeric, because now they seem to know that it can cause blood thinning, which is sort of odd because most medical procedures are pro-clotting. They're inflammatory, so actually increase the risk of clotting. You'd think you'd want to put the person and keep them on nutrition. It's one of those things. And then there's omega-3 fatty acids, fish oil. So if you're going to use fish oil, you want to use a fish oil that is free of contaminants like heavy metals. You can call the manufacturer of the fish oil that you're interested in and ask them for a third-party assay, full disclosure label, which will show you on paper what chemicals are in that fish oil product. And then there's vitamin D. So I have a range here of 2,000 to 5,000 IUs, but you really want to base your vitamin D intake for the best anti-inflammatory effect based on blood tests. So a blood test has a range of about about 30 to 100, and most doctors will say that you're perfectly fine if you're 30 or 31. We know that the higher normal your vitamin D3 level, the lower your overall risk of dying of anything. So I like to get a person no lower than a 70. So there was a meta-analysis, which is a study of all of the properly performed studies on vitamin D3, and that magic number was 70. So if you're in that area, that's what you want to be. Now, if you're deficient, let's say you're a 29 or 20 or 5, your vitamin D is super low, and you're of normal weight, you should be prescribed vitamin D3 at 50,000 units once per week for about 2 months, then you recheck the test. So many doctors will recommend vitamin D3 these days, usually because a client asks them to measure it, and then they don't follow up. Just because you take the nutrient doesn't mean it's going to fix the level. So you want to follow up with the appropriate blood test at the appropriate time. And then there's resveratrol. So resveratrol, as you know, is a very important plant substance that was popularized because of its ability to reduce cardiovascular risk, but we know that it's a very strong anti-inflammatory agent. It has a broad anti-inflammatory effect, reducing many different types of inflammatory processes in the body. So 100 to 500 milligrams is the dose there. And then in terms of magnesium, which no one really thinks of magnesium as an anti-inflammatory, but it is, particularly if the dose is right. And there are different forms of magnesium. There's magnesium spartate, there's magnesium citrate, there's magnesium orotate. So you want to choose the proper type of magnesium for your health problem at the right dose, which is somewhere between 200 and 400 milligrams. Quercetin, which is another plant-based phytonutrient is quite anti-inflammatory. It's also detoxifying, particularly at a dose of about 500 to 1,000 milligrams. And then there's bromelain, which is a plant enzyme. So enzymes are by nature anti-inflammatory. So if my clients have digestive issues and I feel that they are not absorbing well and need enzymes, I might give them bromelain. And if they have joint issues, let's say, or pain and health issues other than the intestinal tract, I will give them bromelain away from their meals. So let me say that again. If you want to improve digestion, you take the bromelain, the digestive enzyme, with your meals because you want the enzymes with the food to digest them. And then if you take the enzyme away from the food, then that will go into the stomach and then it'll diffuse into the bloodstream, and then you'll have enzymes circulating and they can digest various inflammatory mediators in circulation. I first learned that in a book on enzyme therapy when I was in chiropractic school 33 years ago, and that book was written by 3 medical doctors, and one of those medical doctors was a PhD, and they knew it 33 years ago. And probiotics, who would have thought that probiotics are anti-inflammatory? Not just in the intestinal tract, but even if it were true that probiotics only worked in the intestinal tract, we know that they reduce the inflammatory processes that can occur in the gut, and that will reduce the load of inflammation that's circulating to the body. There's different types of probiotics. Some are best for depression, some are best for anxiety, some are best for gut health. So when I'm with a client, I determine the best probiotic for their health issues and give them a dose that seems appropriate too. And I've given you a dose here. If you purchase probiotics, I prefer that they're measured in the billions of organisms in what's called the CFUs. That's the unit of measurement. That's the best measurement. So not all probiotics are the same, not all supplements are the same, but that, in terms of probiotics, is what you want. You want it between 5 and 50 billion organisms and what they call CFUs. And then there's green tea. There's an active ingredient in green tea called EGCG, and you want green tea between 200 to 500 milligrams per day. And it's fine drinking green tea itself, but you may not get the concentration of the EGCG that you need. Also, there's other strategies, lifestyle strategies that may help reduce inflammation. There's a whole foods diet, so one that is rich in fiber and antioxidants, which you'll find in fruits and vegetables, and healthy fats, similar to the Mediterranean diet. So healthy fats like avocados, which have high in monounsaturated fats, which are anti-inflammatory, and then there are the omega-3s in fish oil, and then olive oil, which are omega-9s. Just make sure that when you consume olive oil, you want it to be in a stainless steel tin can, and it needs to be organic, cold-pressed, imported Italian olive oil. You do not want to be able to see the oil. If you can see the oil, so can photons of light, which rancidify or break down or oxidize the oil. And then if you consume oxidized oil, in my opinion, that's one of the worst things you can put into your body to not only promote inflammation, but to increase your overall morbidity and mortality. And then there's hydration. I have a podcast on my website at drmichaelwald.com, or you can visit any podcast platform and search Ask the Blood Detective, and it's entitled something like How Much Water Do You Really Need? So you may want to check that out. There's a lot of clients that I see, they're always asking me, how much water should I have? So I direct them to this presentation. It's brief, and it'll tell you how to manage your water intake. But proper hydration supports detoxification and lowers inflammation. Even a small amount of underhydration can promote inflammation. And then there's exercise. If exercise is combined appropriately with diet, then you can reduce systemic inflammation. But if you're exercising and you're not eating well, you will produce more inflammation that your body will not be able to handle. So exercise can have a negative effect if it's not managed properly with diet. And then there's stress management. Practices like meditation, deep breathing, Pilates, yoga, and other forms of exercise help to lower cortisol levels. And cortisol is an adrenal hormone released during the stress response, which is pro-inflammatory. And then, of course, adequate sleep. You can't repair anything without sleep and rest. So poor sleep increases specific inflammatory markers like C-reactive protein and another inflammatory marker known as interleukin 6. So I've provided you right here on this slide some laboratory tests that you might want to consider if you want to actually know that you're lowering your inflammation. You do not want to count on just how you feel, because many people feel great and they have inflammation going on. And then they're surprised when a disease comes up because they hadn't had any symptoms. I hear that all the time. So we want to use some objective biomarker tests like C-reactive protein, which I've mentioned a few times. There is the C-reactive protein standard test and C-reactive protein cardio. You really want the cardio one because it's more sensitive than the non-cardio version to pick up inflammation sooner. And again, sometimes there are different nutrients other than the ones I've just mentioned that I might provide a person depending on what these tests show. So for example, with cardio C-reactive protein, if that's increased, a very good nutrient in the B vitamin family called alpha lipoic acid can lower CRP very, very well, which means it also reduces inflammation. So I haven't mentioned every nutrient that lowers inflammation. There'd be just too many. So through a careful, well, I'll tell you actually in a minute how we figure that out. And then there's the ESR, that's the second one here on this bullet, the erythrocyte sedimentation rate. Every general physician knows about ESR. It identifies chronic inflammation. It's not specific for where that inflammation is, but it's very useful. And it has to do with antibodies attacking red blood cells, and then the red blood cells stick together. And that's what the ESR is. And then there is an omega-3 fatty acid index where it checks the different components of the types of chemicals, compounds in fish. So in other words, there's EPA and DHA. You want a proper ratio of those. If you have a neurologic issue, then you want more of the DHA part of the fish oil. If you have more cardiovascular issues, you want more of the EPA. And either way, whatever you're trying to improve in terms of inflammation, you want these objective markers and you want to take the right nutrients. And since omega-3s are so important, sometimes I recommend doing a omega-3 index. And then there's vitamin D levels, as I mentioned earlier. That is one of the most important biomarker tests I can think of. For example, when vitamin D is too low, when it's lower than 30, then that will increase one's overall risk of dying of anything. So you want the right amount of vitamin D, and don't assume that just because you're taking enough, as far as your doctor says, you're taking 5,000 or you're taking 1,000 or 500, you want to make sure you're no lower than a 70. That's ideal. And then there's homocysteine, another inflammatory marker that is a good indicator of a variety of diseases. High levels of homocysteine indicate systemic inflammation and increased cardiovascular risk. For years, doctors would fight me on this because I would, let's say, refer them back to their doctors to get that test done. And they're like, there's no evidence, there's no evidence. Now the evidence is everywhere. And it was there before. They just weren't reading their literature. So if you have a high level of homocysteine, you probably need more methylated B12. You might need more methylated folic acid, and there's a few other nutrients that are indicated if homocysteine levels are high. But homocysteine produces inflammation, and depending on where it circulates and what your genetic propensities are, the inflammation might look like dementia, or it might look like hardening of arteries and circulation issues, or it might look like musculoskeletal pain or brain fog. So inflammation has many masks. It is the masquerader of many different diseases and symptoms. And then hemoglobin A1C. Inflammation alone, forget blood sugar, meaning, or even dietary sugar, just a chronic inflammation in the body can increase hemoglobin A1C, meaning inflammation due to, let's say, arthritis of your knee, let's say, will create inflammatory mediators that can affect insulin resistance, causing diabetes, okay? But hemoglobin A1C or glycosylating hemoglobin, very important. It's traditionally used in medicine as a diabetic test, but it is a very important biomarker. And then an advanced lipid panel. So you want to know what your LDL is and your HDL and your cholesterol is and your triglycerides and even the small LDL particles and the large LDL particles. Again, these are the types of tests that are measuring components in your system that can be driven to abnormality. So it's important to get the baselines and then to follow up. And then when I put together a program for people and I recommend these nutrients, I'm just preparing you now to know that the levels of nutrients that I might recommend to you are going to be much higher than the recommended daily allowances. And when it comes to these herbs and things that I've mentioned, there are no recommended daily allowances for them anyway. So your regular doctors might look at the list of nutrients you're taking and say, wow, that's a really high level. You shouldn't do that because it's beyond the recommended daily allowance. But the RDAs, the recommended daily allowances, are, as I've said in all of my podcasts, are the minimum amount of a nutrient you need to prevent a deficiency disease. The recommended daily allowances are not optimal levels of nutrition to prevent disease and manage disease, and also to keep you healthy and improve your longevity. So doctors are just inadequately trained, like I mentioned earlier when I did the educational comparisons. And then the lab tests might not include all of those tests that I mentioned. It might be just one or two of them. If I can figure out what a person needs with an educated guess, I have been doing this for 33 years, then I'm going to do that. But sometimes we need tests, and we'll want those tests, particularly if the information gained from the testing is not something I can guess at. Okay, and then I'll do a nutritional visual exam on a person. I'll look at the quality of their skin and maybe their hairline, and then what their fat distribution is. A lot of this tells me exactly what test to do. And there are other questionnaires as well that you'd complete that guide me to figuring out what your nutrition should be, so we can make it as non-neurotic and as correct as possible, so you can maintain these healthy changes over the course of your lifetime. Well, this information was useful to you. Inflammation is fundamental for progressing disease, and anti-inflammatory approaches such as the use of diet and lifestyle measures and nutritional supplements and different combinations are very effective, in my opinion, for mitigating the inflammatory response. So I'll see you at the next podcast. Thank you so much for joining me.